ODP. Operating Department Practitioner.
Operating Department Practitioner.
Operating Department Practitioner.
Hello, my name is Lee Stewart. I'm an ODP and have been for 7 years. I'm also a clinical educator, which means I help facilitate all theatre staff's education, be it nurse, ODPs, healthcare assistants or theatre support workers. For those who are unaware of what an ODP is, which is pretty much most people outside the theatres, an operating department practitioner is trained in 3 areas of the operating department. One is anaesthetic, so we assist the anaesthetist. The other one is surgical scrub, so we're sort of similar as a scrub nurse, we assist surgery. And the last one is in recovery, we assist in recovering the patient after they've had their surgery.
So my name's Faye, I've been an operation department practitioner for 4 years now, working with Sunderland Royal Hospital. My daily job involves coming into the anaesthetic room on a morning, checking all of the anaesthetic equipment, preparing all of the drugs for the patient. I act as the patient's advocate during the operation and assist the anaesthetist. So since being qualified as an operation department practitioner, the job is very challenging at times, but also at the same time very rewarding. Helping a patient, seeing that patient through till the very end of the procedure is very rewarding.
My name is Gareth, I'm an advanced scrub practitioner at Sunderland Royal Hospital. My typical day starts by coming in, checking which surgeon I'm working with, and then going around to the day case unit to meet the patients. Once that's done, going back around the theatre, bringing up any x-rays that might be needed, letting the theatre staff know what kit we need, and then meeting up with the surgeon to discuss the plan before doing the morning who. My career I started about 10 years ago as a healthcare worker in theatres, and then I went off to do my ODP training, qualified just over 5 years ago, and I decided to take a career in orthopaedic scrub. Worked 5 years in trauma, upper limb, lower limb, hip and knee arthroplasty, pretty much everywhere over the 5 years. And then in January of this year, 2018, I was fortunate enough to gain a promotion to become an advanced scrub practitioner, or might also known as an ASP. I've just pretty much described what my job entails now. You know, you're an ASP, or you know, as a surgical first assistant. Basically, that is what we do. I assist the surgeon. So I'm currently doing a course at uni to learn about tissue retraction. You know, we do hemostasis, catheterization is part of my job now, suturing once competent, and then do pre-op and post-op visits to patients, applying dressings, casts.
Hello there, my name's Gary. I'm an operating department practitioner. My role within the theatre area is to work in the post-operative care phase, which is probably one of the most important phases post-surgery, because if there's anything going to happen to the patient, it's going to happen within the first half hour of post-op surgery. It's a very important role because you're working one-to-one with a patient with no doctors around. So if an emergency happens, you need to know what you're doing before you get the doctor or the anaesthetist to come and see the patient. So every patient that we come through will work through the critical care phase, which is the A, B, C, D, E phase, which is A, airway, making sure the airway is clear. We don't move on from A to B until A is secure. B is for breathing, to make sure the breathing fine, checking the respiratory rate, the depth of breathing and the oxygen saturation. We move on from B to C, which is circulation. Circulation is mainly the observations, so the ECG, the heart rate, the blood pressure and the capillary refill time. We move then on to D, which is dressings, drains, drips and drugs to maintain they're running fine. and then E to evaluate the care of that patient, and then move back onto A. And that's the same with every patient you look after.
My name's Stephen Bell. I'm the theatre manager. I originally started here around about 22 years ago. I started as an outside porter. It was only for a week initially. I thought I'd find something to do while I was on leave from Africa, working in Africa. I decided I loved the job, loved the people. So I've been an outside porter, an inside porter, theatre support worker, then I trained to be an ODP, a team leader in anaesthetics, ODP. Done a years out to work for Trust Headquarters on Lean, the Lean process and 5S. Then I progressed to the coordinator of theatres, then the deputy manager, and today I'm the theatre manager for orthopaedic theatres, plus now the day case unit as well.
If you're interested in becoming an operating department practitioner, there are various routes which you need to go through in order to become a registered operating department practitioner. Ultimately, you'll have to do a university course in an approved university. At the minute, it's either a 2-year diploma course, or most universities are now turned to a 3-year degree course. Ultimately, it's to become the end product, which is operating department practitioner.